Hello, my name is Dr. Jeff Stark. I'm the head of medical immunology at UCB, where I lead the rheumatology and dermatology medical affairs teams. Very happy to join you today to talk a little bit about the recent approval for Bimzelx in hidradenitis suppurativa. I'd like to say first and foremost that hidradenitis suppurativa remains a disease for which there is substantial and significant unmet need. As many of you will know from your own experience, perhaps even taking care of HS patients, these patients experience painful inflammatory skin lesions that lead to swelling, drainage, foul odor, and ultimately irreversible tissue damage in the form of disfiguring scarring. And although there are some approved treatment options for hidradenitis suppurativa in the US today, the situation is still that there are many patients who don't achieve the degree of disease control that they desire or the quality of life that they need. And so we are very excited to have reached the milestone of approval for Bimzelx in hidradenitis suppurativa, and very grateful to have the opportunity to bring Bimzelx to the HS community as a new treatment option that we hope will move them further along their journey in seeking disease control and improved quality of life. We believe that this will be very important for the community, both on the healthcare provider side as well as the patient side. I've mentioned the patient view and the journey that these patients undergo. This has been very important to UCB historically over the last several years. Our engagement with patients has been an extraordinary opportunity for us to learn what their experience is, what their needs are, and to create a clinical program that we hope will help to meet their needs in terms of the characteristics of the data that support the approval of Bimzelx in HS. But we recognize as well that the healthcare community, particularly in dermatology, who provides care for these patients, has really also been seeking new treatment options that they hope will lead to better outcomes and better quality of life for their patients. And so we're very excited to have the opportunity to bring Bimzelx to them. There are several, I think, exciting aspects about the newly approved prescribing information that now encompasses a Bimzelx indication for HS. The primary endpoint in the two phase 3 studies, which are called BHERD-1 and BHERD-2, was a high score of 50. I'll pause for a moment and just say that I really love the name of these studies. HS is a disease that can be extraordinarily socially isolating for patients. And so there really is, I think, a great opportunity for HS patients to be better heard. So we're very happy to recognize that even in the names of our studies. Although high score 50 is a very important endpoint, and we certainly saw that that endpoint was met with statistical significance in the studies, we also recognize that patients are aiming for even more than a 50% improvement in their disease activity. And so we had the opportunity, in keeping, I will say, with the rest of the Bimzelx clinical program across other disease states, to look at a higher bar of efficacy, more stringent endpoints, and captured that in the high score 75 responses as a secondary endpoint. Both high score 50 and high score 75 responses are included in the newly approved Bimzelx prescribing information for HS. And we're really excited to have the opportunity to bring those to the community, not only to inform clinical decision making, but also to have an opportunity to highlight the need for more stringent, higher level outcomes for patients living with HS today. The other aspect of data incorporated into the label that I'm very excited about is a recognition of the improvements in pain that patients treated with Bimzelx achieved in the clinical trial program. Among the many symptoms that patients with HS experience, pain is almost universally the one that comes to the fore, the one that they mention the most, the one that causes them the most impairment of quality of life. And so we're very happy to have, with a recognition of those data in the prescribing information, the opportunity to highlight the importance of pain control and also the degree to which we saw pain improvements in patients in the Bimzelx clinical trial program. Now, although HS is a disease that is perhaps well recognized and to some degree understood, one of the significant barriers that continues to exist for these patients is a long delay in diagnosis. This may be for many reasons. It may be because of the stigma associated with the disease and the hesitancy of patients to even seek care. But it may also be because of a frequent misdiagnosis as patients present to various and diverse aspects of the healthcare system, and sometimes to healthcare providers who may not be familiar with HS or its treatment. The result of that is that patients may experience sometimes an 8, 9, 10-year delay in diagnosis before they end up in an appropriate care setting and have the opportunity to receive appropriate therapy. In HS, like all inflammatory diseases that can lead to permanent irreversible tissue damage, that delay can be catastrophic for these patients in that a window of opportunity is missed. A window of opportunity in which, if we intervene appropriately, we may have the ability to modify the patient's disease course and actually prevent damage from the inflammation of HS. For us, this new approval in HS is really an opportunity to educate and to raise awareness about these patients in hopes that we can shorten that patient journey, move them to diagnosis and treatment much more quickly, and hopefully reduce the burden of disease and improve their long-term outcomes by preventing the damage that we know HS can cause. I will say, perhaps just in retrospect, over this last year, or maybe perhaps 13 months, it's been a very exciting time at UCB. We've had the opportunity over that period of just a little over a year to bring Bimzelx to the rheumatology and dermatology communities with 5 approved indications and 1 additional device, which is a 320 milligram dosing device. I'll mention just a word about the device. I think the timing of the 320 milligram dosing option is very wonderful for patients with HS because 320 milligrams is the on-label dose that they should receive. So we're very excited to have that dosing option for those patients and hope that it will prove to be a great convenience to them in how they experience using the drug. Our range of indications for Bimzelx over the last 13 months began with an approval for adults with plaque psoriasis, and then moved on fairly recently over the last few months with an approval for another important aspect of psoriatic disease, which is psoriatic arthritis. There was a near simultaneous approval for the 2 components of axial spondyloarthritis, both ankylosing spondylitis and non-radiographic axial spondyloarthritis. And now, just hot off the press within the last couple of days, is the most recent approval for hidradenitis suppurativa. We've been very excited since those approvals to hear about the experience of the clinical community and patients receiving Bimzelx for those now approved indications. And I think that those exciting stories that we're hearing from the community really for us at UCB inspire us and justify the work that we do and definitely fuel us in our effort to continue to provide differentiated solutions for patients. It's very early days, of course, for hidradenitis suppurativa, with that indication having only come a couple days ago. But immediately, we are hearing excitement from the healthcare provider community, and even more importantly, from patients who are thrilled about that news and excited to now have a new and different treatment option that we hope will help to improve their symptoms, their quality of life, and their long-term outcomes in hidradenitis suppurativa.